Welcome. Thank you. Tonight we have with us Dr. Mark Proctor of Boston Children's. I'm really excited for this one because incidental findings are the topic and it's come up numerous times. So I'm really glad that someone's taking it head on. So first, I'd like Dr. Proctor to just talk a little bit about why he's interested in all of these disorders, how he got started, and then he's going to have a brief presentation, and then I'll come back when it's time for the Q&A session. So Dr. Proctor, go right ahead.
Great, thanks, Caitlin. So how I got interested, I am at Boston Children's Hospital, where I'm a craniofacial, which is skull abnormality, and spine abnormality specialist. So I've dealt with a lot of deformities of the spine, and that's how a lot of Chiari malformations present in children. They present with spinal deformity from the syrinx. So I think that's sort of been the natural evolution of how I got to be interested in Chiari as an entity. It just happens to fit a lot with these craniofacial disorders, where one of the consequences of many of them is a Chiari malformation, as the brain is sort of squeezed down. And then a lot of kids that present with scoliosis, it's from a Chiari malformation. So as Caitlin said, I'm going to talk about Chiari as an incidental finding, and I will bring up my talk now. Caitlin, please let me know if for any reason you can't see that.
Can see. All good.
Great. So title of the talk is Management of Incidental Imaging Findings, Chiari I Malformation, no conflicts of interest. And just to give a little bit of basic background, because I don't fully know who's in the audience, but for Chiari malformations, what are they in general? And you can see that they were discovered or identified by Hans Chiari, who was an anatomist in Austria in the 1800s. And he has a few syndromes named after him. There's Budd Chiari, which is a liver disease. Then there are the Chiari malformations. And these are 4 different malformations of the cervical medullary junction. That's sort of the junction of the brain and spine. And what's important to understand is that these 4 different ones are not a grading scale. In other words, if you've been diagnosed with a Chiari I or your child, it can't become a Chiari II or a 3 or 4. They're completely different entities. They just happen to all be identified by Dr. Chiari back in the 1800s. So we're going to focus only on Chiari I malformation, also co-identified by this Dr. Julius Arnold. So if you hear the term Arnold Chiari malformation, that's your type 1 malformation. So Chiari I or Arnold Chiari is what we're focusing on here. And what exactly is Chiari I? It's when the back of the brain comes out beyond the edge of the skull. So the what's called the tonsils of the cerebellum are displaced inferiorly, and they have to be down at least 5 millimeters before you start to call it a Chiari malformation. And to be clear, it's very interesting. The radiologists now no longer even call this Chiari malformation. They're calling it Chiari deformation, because malformation makes it sound like there's something critically wrong. And in many cases, Chiari I is just...
I cannot wait for that new stick.
Yeah, you're excited?
Yeah.
Thank you for muting. But in many cases, it's just found incidentally, right? It's not, so malformation was felt to be somewhat strong wording. So here's a classic Chiari I malformation. This is a pretty severe one. Here's the back of the brain here coming down beyond the edge of the skull, which is right over here. And in this case, it's about 25 millimeters. So it's coming out of the skull, going beyond the C1 all the way down to C2. So that would be a classic Chiari malformation. So if you look at Chiari malformations, and I just updated the numbers 2 days ago, there's over 5,000 articles concerning Chiari malformation if you do a medical search, but less than 100 of them have to do with the natural history of the disease. So the reality is most people haven't really followed the natural history. But this is here, just a recent study just came out in 2021 from Child's Nervous System, a pretty well-regarded pediatric neurosurgery journal. And you can see in their conclusions that overall the natural history of asymptomatic Chiari malformation is benign. Patients treated non-operatively are unlikely to progress. And if they do progress, it's usually within a couple of years. And we'll go over some of this progression. And just to give you the punchline, in almost no cases is the progression severe. Like if you're thinking, well, should I've been diagnosed with a Chiari malformation, should I have it operated on just because it's there? The conclusion I'm going to give is that no, you shouldn't. But we'll go through more of the literature here, and that all of which sort of supports a benign natural history. Just I always think it's interesting to focus in pediatric neurosurgery. Is it controversial? Like, is Chiari malformation controversial? And I would say it's actually very controversial. And it is the only condition that our parent organization, the American Association of Neurological Surgeons, has come out with a position statement against surgery. So the concern was that in the late 1990s and early 2000s, there was actually too much surgery being done for Chiari malformation. More people were getting MRI scans. This was being discovered more and more often. And there was a trend of operating on it for things like chronic fatigue syndrome. And you can see this statement from the AANS that there is no scientific evidence that chronic fatigue syndrome is a neurologic disorder or that it requires surgical intervention. So it's an area where I think probably there is too much surgery going on. It's probably better now than it was 20 years ago, but for the parent organization of a group of surgeons to suggest not to do surgery is a pretty strong statement. So what defines Chiari malformation? We sort of said that it's at least 5 millimeters of the tonsils below the edge of the skull. Some articles have challenged that, said it could be less than 5 millimeters. And then there's a whole group of newer concepts of Chiari 0. That's like normal, no Chiari, but a syrinx. Chiari 0.5, which they describe as the cerebellar tonsil sort of wrapping around the brain stem. Chiari 1.5 is supposed to be a more complex Chiari 1. So people are sort of adding on. So, Hans Chiari identified 4 Chiaris. Now we have maybe 7. So what is the incidence? How many people have Chiari? If every one of us were to get an MRI, how often are we going to see it? And the answer is a lot. So at Johns Hopkins, they looked at more than 22,000 MRI scans and found that 175 people being imaged for totally other reasons had Chiari malformation. So that was a little under 1% of people having a Chiari malformation. And in the pediatric population, it's even higher. So if you look at this study from Michigan, from Dr. Marr, who's very well known in this field, they found nearly 4%, so 3.6% out of 14,000 consecutive MRIs, 3.6% of the kids had a Chiari. And it sort of makes sense that the fuller your brain is, the more likely the back of the brain is going to be pushed out of the skull. And unfortunately, as we age, our brain starts to shrink a little bit. And so the incidence of Chiari is higher in kids than it is in adults. And some of the risk factors for the Chiari being symptomatic, not asymptomatic, as you can see in their study, was girls greater than boys, slightly higher age, so it sort of peaked in teenage years, and they had a higher degree of tonsillar herniation, like the brain was lower, is more likely to be symptomatic. So what does define asymptomatic? First you have to think, okay, what are the symptoms? Like, why did the person get the MRI scan? Is it classic headaches in the back of the head with exertion? Well, that's probably not then asymptomatic. That may be symptomatic. But are they frontal headaches? Headaches are very common in the population. And we wouldn't say that frontal headaches are never associated with Chiari malformation, but it's certainly atypical. So you could be having headaches for lots of other reasons and still have a Chiari malformation. As we already said, chronic fatigue and polymyalgia, that the concern there is that is not related. Is a syrinx a symptom? And I'll go over this because I know some of these questions also came up in the Q&A portion. Is scoliosis a symptom? Some people might ask about CSF flow studies, so we'll go over all of these things. So Chiari and syrinx. So I'm going to skip one slide ahead and come back to this just to show you what a syrinx is. So a syrinx is when this is a classic Chiari malformation, the back of the brain coming a little bit too low, squeezed behind C1. So if you sort of look above my arrow here, that's just a classic Chiari. And then just below it, here you see a syrinx. So a syrinx is a expanding fluid collection in the spinal cord. And we all have a little column of fluid in our spinal cord. It's just so small that you almost can never see it on the MRI. But when you see it like this, that's called a syrinx. So is that a reason to consider surgery? And I'd say most surgeons, most neurosurgeons are going to say if you have a Chiari causing a big syrinx, you really should have that operated on. So why is that? It can cause scoliosis, and many of these kids do present with scoliosis. But the other problem is it can cause really bad pain syndromes and even neurologic deficits over time. So if you see an adult with a large syrinx, they may have presented with bad pain or sensory issues, as opposed to kids who are more likely to develop scoliosis. And if you operate on the Chiari after the pain syndrome has developed, the pain syndrome often doesn't go away. So Chiari and syrinx, that's a pretty good indication. This is just the same slide. But one issue is that there's a lot of, plural of syrinxes, syringes. There's a lot of syringes that are not related to a Chiari malformation. So we did a study at our institution, and there's been a subsequent study where we looked at syrinxes. So as more kids were getting MRIs, we tended to see more syrinxes or syringes. And we would see these sort of relatively smaller syringes that were not dilating the spinal cord, and there was no associated Chiari malformation. And we now know that kids can just have these, that there are a certain number of people, not just kids, that it's just a developmental anomaly. So you can have a syrinx, not have a Chiari malformation, and it tends not to change over time. So we followed 50 kids for several years and found that they didn't change, and they had no symptoms related to them. So you have to be a little careful. You could have a syrinx that's not caused by a Chiari, and yeah, you don't want to operate on the wrong ones. How about Chiari and scoliosis? So almost always, if you have a Chiari malformation and scoliosis, it's because you have a syrinx. The syrinx causes a slight dysfunction of the spinal cord, and that causes the spine to bend over time. So if you have a Chiari scoliosis but no syrinx, that's probably not a symptomatic Chiari. CSF flow studies, you may have heard about these. It's an MRI sequence where they look at how the brain pulsates at the back of the skull and whether the fluid transportation is impeded. And they can be helpful, but they tend not to be a lot better than clinical suspicion. So if someone's having symptoms, has a Chiari malformation, the flow study is probably going to show that there's reduced flow, and vice versa. So if we look at what's an asymptomatic Chiari, I would define it as you actually have a Chiari I malformation. So the tonsils are at least 5 millimeters below the foramen magnum. You don't have any clinical symptoms of a Chiari malformation. You don't have a syrinx. And the things that are still a little unclear, what if you just have a scoliosis but no syrinx? And what about CSF flow study results? But suffice it to say, there's a lot of kids and adults who get an MRI, have a Chiari malformation, and it was a complete surprise finding. They were getting an MRI for another reason, like they hit their head or they had a seizure or things like that. So what are the reasons you'd ever consider surgery for an asymptomatic Chiari malformation? Well, one, it may become symptomatic. Okay, well, you can always treat it when it becomes symptomatic. It may result in a spinal cord injury if left untreated. Well, this is a controversial topic that we'll go over. I think there's very little evidence to support that. And the third is that a syrinx may develop over time. And I would say there's no good data to support this. Syrinx is almost always present at presentation, and it would be extremely rare, not impossible, but extremely rare for a syrinx to develop later. So it's not a good reason to consider surgery prophylactically. So if we look at will an asymptomatic Chiari malformation become symptomatic, there are several studies, including the one I showed you earlier. So this was a nice study from Italy, from Dr. De Rocco, who's a very well-respected pediatric neurosurgeon. And they followed 22 asymptomatic or minimally symptomatic Chiari malformations. Only 14% of them ever went on to need surgery. About a quarter of them had some worsening of symptoms, but most of them were mild enough that they didn't need an operation. And most importantly, there were no catastrophic events. So in no case was there some event that led to a bad outcome where there was a bad brain or spinal cord injury as a result. And they did follow-up articles on this as well. This is a nice study that was from Miami Children's Hospital, from Dr. Sandberg, who's now in Texas, and they looked at 124 cases of Chiari malformation, followed them out over nearly a decade, and only 14 had symptoms, and only 5 went on to require surgery. So you could see 5 out of 124, less than 5%. So another study suggesting that the natural history here is pretty benign. This is another study from Dr. Marr, who I mentioned is very well known in this field, and he followed 148 patients for over a year. The mean follow-up was actually nearly 5 years, which is pretty good in this field. 16 of those patients, so just a little over 10%, worsened and required surgery. And you can see some did develop syrinx. So as I mentioned, you can develop syrinx. It's relatively unusual. In this case, it was less than 5%. But it's unusual, and the fear of developing a syrinx shouldn't be a reason to operate. So are patients with Chiari malformation, are they at risk for a brain or spinal cord injury? And by and large, the data would say mostly what they're at risk for is just that the Chiari malformation may become symptomatic. So this is a series from Dr. Charles Tater in Toronto, a very well-respected neurosurgeon. And they found that out of 85 Chiari patients, 13 of them became symptomatic after a trauma. So it doesn't mean that trauma caused this Chiari malformation. In fact, it almost certainly didn't. But the trauma caused the Chiari to become symptomatic from an asymptomatic state. But none of these were severe issues. They all were things that could be treated with surgery after the fact. And similar, the group in St. Louis with Dr. Limbrick, who's probably the most well-known pediatric neurosurgeon in this field. He had 189 patients, and only 6 presented acutely after trauma. So generally not a big issue, and all improved with surgery. So there were no outcomes where something was irreversible. Again, other case reports, like case report is just like a single case of people becoming symptomatic after from their Chiari malformation after a head trauma. And again, this is just a little bit more of the same. Here's a case, a baby that I took care of just a little over a year, fell down a set of stairs, had a skull fracture, and interestingly, here you can see, had a Chiari malformation with some injury to the cerebellar tonsils, which is this sort of whitish area in the bottom of the brain here. And then 6 months later, it was gone. Maybe a slight Chiari malformation, but the bruise was gone. And that's not with any surgery. So yes, you could have some mild injuries related to the Chiari, but they are almost never going to cause something very severe. How about spinal cord injury? This is sort of this is like the biggest concern anyone's ever going to have about a Chiari. It's like, well, gee, if I have a Chiari and I have a significant trauma, am I going to have an injury to the spinal cord? In other words, be left paralyzed. The reason that people are worried about is there have been some case reports where people have had traumas where they were minor enough that the clinicians were surprised they had a spinal cord injury, and they also had a Chiari. So there's people have pieced together a few reports, but literally these are in the case report numbers. In other words, nobody has 5 patients that have done this. They've seen a patient that's done this. And most importantly, no series that's followed a series of patients with Chiari malformation, like all the ones I just showed you, they've never had one with a severe spinal cord injury over time. So I think the general incidence is quite low. This is the scan I showed you earlier, but just the clinical situation. This is a guy, he was totally asymptomatic from his Chiari until he spear tackled in football. That's when you like lead with your head. And he presented with actually reasonably good signs of injury. He was really off balance. So in him, we did operate. Here you could see after the surgery. So it went from this, we take off some bone in the back of the skull and the first vertebrae. This is what it looks like after. And he remained with some brisk reflexes, and that's just mean like, you know, when you do a knee jerk, it jerks pretty quickly. But overall did great and actually even got back to playing football. So how about Chiari malformation in sports? I'd say that the presence of Chiari malformation that is symptomatic, in other words, like an athlete has symptoms of Chiari, like bad headaches or other findings, that most of us would consider that a contraindication for contact sports. And really, we almost mean collision sports there. So sports like tackle football, ice hockey, wrestling, where you really have it, even in normals without Chiari, you have an incidence of spinal cord injury. But if you have an asymptomatic Chiari, it's really not a contraindication. Some people may consider it a relative contraindication, meaning that we're going to have a careful discussion with that family regarding, is it safe to participate in the sport? But there's really no data to suggest that they can't participate in the sport. Like I said, the incidence of injury is quite low. And then how about an athlete that's had surgery for a Chiari malformation? Can they go back to sports? And the answer is yes, they can. In fact, they're probably safer than they were at their baseline. And here's an example of this. This is a 19-year-old it was a pole vaulter, and she actually became symptomatic when she was in college, and she was doing Habitat for Humanity and painting ceilings and looking up a lot, and all of that extension of the head can cause symptoms in a Chiari. All that extension of the head gave her really bad headache, which led to the MRI scan. So we treated her. Here she is before and after surgery, and she actually got back to pole vaulting. So once you've treated it, you've now taken any pressure off the back of the brain, and it's safe to go back. And ironically, I'm now treating her daughter, who also has a Chiari malformation. So needless to say, this was a few years back. So in conclusion, and so we can move it on to questions, with the increasing use of MRI, asymptomatically discovered Chiari malformation has definitely been on the rise. And now we know the incidence is sort of 1%-ish in adults and probably more than 3% in kids. There's no absolute consensus on how to manage it. And I'd say, yes, symptoms can progress. If they do progress, you can have surgery, but there's no data to support prophylactic surgery. So I see people not infrequently where they say, well, my surgeon said I can't participate in X, Y, and Z before I have an operation in an asymptomatic patient. And I basically would say, gee, if that was my MRI or my child's MRI, I would not be concerned. I would let you participate because the risk is actually pretty low. And as I said, only anecdotal case reports have demonstrated a link between asymptomatic Chiari, those not causing any symptoms, and ultimate brain or spinal cord injury. So hopefully that gave you a little bit of my sense of how to treat these. I'm happy to go into the questions.
Excellent. Thank you, Dr. Proctor. You can still hear me, right? Okay, sorry. I did want to start with a couple of the questions that came in ahead, because I try to do things pre-surgery, surgery, and then post-surgery, just to kind of a logical flow. But there was a question about concussion, since you were talking about sports participation. So Can a concussion cause a Chiari, or could one make it more likely that a Chiari might become a problem in the future? I know you talk about it a little bit, but can you speak to concussion specifically?
Sure. So there's two halves to the question. Sort of, can a concussion cause a Chiari? And the answer is no. So if you didn't have a Chiari malformation, you had a concussion, it's not going to make you have a Chiari malformation. However, as I stated in the talk, can trauma of any sort of head trauma, and concussion is just a mild head injury, it's not, it is definitely a trauma to the brain, can that cause you to have an asymptomatic Chiari become symptomatic? And the answer is yes, it can. So we do know that Chiari malformation can present after a head trauma, be it minor or otherwise. Mostly it's going to be minor, right? If you have a serious head trauma, there's a lot else going on. So yeah, you can have the onset of symptoms from a Chiari after concussion. The question might also be asked, if you have a Chiari malformation, are you more likely to suffer a concussion? And the jury's actually out on that one. If you look at all kids that have a concussion and go on to get an MRI, like, is the incidence of Chiari now higher than 3% in that population? I don't know of any studies that have looked at it. We have this general sense that maybe it's a little higher in our population, but I can't support that with like a study that shows that to be the case.
Sure. Is this syringomyelia specifically ever likely to go away on its own? I know you talked a little bit about that, but the need for surgery in syrinx.
So if the Chiari is causing the syrinx, that I have, just want to be careful about that, because there are syringes that are not associated with the Chiari malformation. It is possible, like anything that has a low incidence, like 2-3%, can be associated with anything else with a low incidence. It will be infrequent, but there's going to be those patients that have it happen that will sort of overlap those Venn diagrams. So if the Chiari is actually causing the syrinx, does the syrinx have a chance of going away? And I would say very rarely we've seen that happen. Like Dr. Mara has a case he likes to present in a talk of that happening. I have a patient in whom the syrinx went away without any intervention. So it's possible, like, if you say, well, do you have to rush into surgery because you have a syrinx, or is it safe to give it a little bit of time? If you're not very symptomatic from it, it might be safe to watch it, because very rarely they can go away.
Mm-hmm.
But the reality is most of the time they won't go away without an operation.
How common are spasms or like twitching in Chiari and syringomyelia? What's possibly causing this? Is it related to a syrinx, or is it something else? And if it is something else, what would you consider?
I would say, I'm sorry, I didn't stop my share. There we go.
That's okay.
I would say in my experience, I haven't seen many people present with spasm, nor do I know about that much in the literature. It wouldn't be impossible. I mean, if you have a pretty large expanding fluid collection in your spinal cord, can it have an effect on your motor system? It can. So I don't want to say there could be no relationship there, but it wouldn't be common. Like, it's not something we see a lot of. What else can cause spasm? That's a little bit out of my area of expertise, so I don't want to speak to other things. I mean, when we see like some spasms in the face, we know it's from a nerve compression. But the cause of spasm overall is not something I'd be an expert in. But I'd say if you have a syrinx, it's maybe, if it's a really big syrinx, maybe it could be related, but it's not a common association.
This is in the chat. What is the significance of a unilateral Chiari? So one tonsil is lowered down to C2 and the other appears completely normal. So in this case, the person has already had a decompression, but one tonsil kind of descended again while the other one's staying put. Is that something that you look at going forward?
I'd say in my experience that's pretty unusual. So it's not uncommon for one, when you're operating on a Chiari, it's not uncommon for one tonsil to be a little bit lower than the other. I haven't necessarily seen it where I think you said one tonsil was down to C2 and the other one was in a normal position. So now you're implying like one tonsil is nearly 20 millimeters or so lower than the other tonsil. Not something I've seen maybe ever. So if it's post-surgical, when we see a Chiari after surgery, there's a couple of things you think about. One is it wasn't decompressed well enough, so there's still some bone on one side and that's pushing it down. The other side was well decompressed. The other is a phenomenon known as cerebellar slump. So if you think the cerebellum's at the bottom of the brain, if you take out a lot of bone, you can imagine nothing now is supporting the brain, and it can actually come down lower. So one thing people are careful about is not to take out too much bone. So, and obviously I don't know anything about details of this case, but you could say, well, maybe more bone was taken out on the side where the tonsil's now lower than on the opposite side. But I wouldn't say I completely understand the significance of it. I think that's one where you'd sort of have to look at this study and try and figure it out. Was there some bone not taken on the one side? Was too much bone taken on the one side? And like, what was it being done for syrinx? Is the syrinx now better? Because then you'd still be reassured. There's a lot packed into the question that you need more specific information for.
Sure. This is like the last kind of pre-surgery question, I think. If a Chiari's been diagnosed, it's pretty large. There's hardly ever a headache, but stuff like brain fog and other things that might be coming from a tethered cord that was diagnosed later. But that biggest issue is the neurogenic bladder. Is that like what kind of surgery would you suggest for that, especially if there's no headache?
So it's that's a case that's a little complicated, and it's not like I could say what surgery I'd suggest without reviewing the films, but I could talk a little bit generally on, is tethered cord associated with Chiari malformation? And specifically, like if we think of Chiari malformation as the brain sort of being pushed down, like just think of it almost like there's too much brain for the amount of skull. And that's why as our brain shrinks over the years, with Chiaris are less common because there's enough room in the skull. Most Chiari malformations are that mismatch where there's a little bit too much brain for the space that it's in. The theory with Chiari malformation and tethered cord is that actually there's tension on the spinal cord pulling the brain down. Many of us are not big believers that tethered cord is really going to cause a Chiari malformation, because what happens at each level of the spine, there's something called the dentate ligaments. They're like little triangles that come off the spinal cord and anchor it to the dura. The dura is like the skin over the nervous system. So at each level you have that. So by the time you get to the bottom of the spinal cord, you have 30 of those dentate ligaments. So if there's a little pull at the bottom, it has to overcome all 30 of those ligaments, and there's actually 60 because there's one on each side, to pull down the brain. So can a tethered spinal cord cause a Chiari? Most people, I would say most people don't think that happens very often. Not to say that's universal, but most people don't believe it. If the primary symptoms are bowel and bladder, in other words, like the person doesn't have a lot of headaches, then bowel and bladder symptoms are far more likely to be caused by tethered spinal cord than by Chiari malformation. So it could be in this case that you can have both, right? And I've seen both, and I've had patients who've I had to operate on both conditions, but it's reasonably unusual. But if the bowel and bladder is the primary symptom, you probably want to look towards tethered spinal cord, especially if you're not having much in the way of headaches or brain symptoms. The brain fog is a little hard to know. You know, this day and age, a lot of us are having some brain fog, so it's hard to know if that's from a Chiari malformation. We don't usually think of Chiari malformation as causing sort of cognitive and thought-related disturbances.
I just had brain fog because I almost forgot to ask that question, so reasonable. So getting more into the surgical questions, this is pretty specific. I actually don't know what this is, so I'm going to learn today too. How often would a seroma form after a surgery, and would you watch something like that?
Seroma, is that the word used?
Seroma, S-E-R-O-M-A.
Yeah, seroma. So when we think about a seroma, it's generally a fluid collection. Let's say we've done an operation on the brain up here, and we've removed some of the scalp and put it back. Seroma is generally thought as like sort of a fluid collection from fluid being produced by the scalp, or it can happen anywhere in the body. You know, it's because when we injure tissue, so to speak, and surgery does cause a temporary injury to tissues, it reacts by having swelling. So I'd say seroma isn't too common after Chiari surgery, but I do wonder if what they mean is something akin to a CSF leak under the skin. So can you have, when there's different ways of doing a Chiari operation, right? There's what we call bone only, where you're just taking off the bone at the back of the skull in C1. And then there's bony decompression along with duroplasty, where you're opening what's akin to the skin over the nervous system, the dura. When you do that, you've opened a watertight layer, and now if you don't get it closed in a watertight fashion, it can lead to a leak of fluid. So I would say most times if there's a fluid collection by the incision after a Chiari operation, that's a CSF collection, so cerebral spinal fluid collection. And I guess the question was, how often does that happen? You know, unfortunately, it happens. You know, I feel like it's a relatively low incidence in the patients I operate on, because I'm really careful about trying to get a watertight closure. But even in my patients, I've had it happen, and I had to go back and reoperate. So if you have it and it's just like fluid and it's not causing symptoms, you could probably watch it for a little while. If it's getting bigger or any fluid leaking out of the skin, then you probably need to reoperate. And then the question is, well, if it's small but it's been there for a while, I think you could probably go either way if it's not causing any problems.
Mm-hmm.
But I'd say most fluid collections after Chiari surgery are probably small CSF leaks. And
that kind of begs the question about what is your take on duroplasty or no duroplasty, which I don't know if you want to explain what that, you kind of just did with the bone only.
Yeah, again, the duroplasty is in addition to taking up the bone, do you open up the dura? I think the evidence is becoming more and more that you should probably open the dura in the setting of a syrinx. I mean, there's a big national study led by what's called the Park-Reeves Consortium. Dave Limbrick, who I mentioned earlier, and one of the articles was the lead. And it seems more and more convincing that if you have a Chiari and syrinx, you should open the dura. If you're doing it just for headache or something, it's less clear. I would say most of the patients in whom I feel that they really should have the surgery for Chiari, I also feel that they should have the dura open. So why not open the dura? Theoretically, the healing and complication rate is lower if you don't open the dura, although in the big Park-Reeves studies, what they found is that the complication rates were not lower in the bone-only operations, but the reoperation rates were higher. The number of people who didn't get better and had to go back and have a second operation was higher. So I tend to open the dura. I don't want to say I always open the dura. And if I'm unsure, we could do a study during the operation, an ultrasound study to look and see if the brain looks relaxed now. But by and large, I will open the dura.
You're setting up these questions excellently, by the way. So how long after the surgery with the duroplasty does it generally take for that dural patch to heal and for those sutures to firm up without being afraid of them kind of like opening up and rupturing? And I'm going to add a question, is that different for an adult versus a child?
So my general practice will be when I do the operation and my patient population is kids, that I don't that we don't lock anyone, like we don't put them in a bubble, but for 4 weeks, I'll keep them out of PE class or any, just being out on the playground unsupervised, etc. And then if they're fine at 4 weeks, I clear them fully. Is that how long it takes to fully heal? No, I mean, full healing after any operation, let's say if you break a bone, you don't expect it to be 100% strong for a year, but even skin takes about 3 to 4 months to get to its original strength. I would just say for most people, 4 weeks, it's strong enough that they can get back to their activities. Is it different for an adult? I would say in general, kids heal more quickly than an adult. The funny thing is that kids are also, they're going to get back to things sooner, right? There's the recovery for an adult in many ways is longer. So what I might say a month for in a child or a healthy teenager, adults may need longer just before they feel well enough to do it. But I don't know that it's it's not because they're not healed. I just think they take longer to feel well after surgery.
It's back. This question came in a few times. So what would your suggestion be for an completely incidental finding of Chiari and syringomyelia? Both are totally asymptomatic, but both are pretty pronounced. So the syrinx is about 9 millimeters and Chiari is down to C1. 11-year-old, pretty active. What's your recommendation in a patient like that?
So assuming that it's a syrinx that I think is being caused by the Chiari, so 9 millimeters is usually there. We're talking about the diameter of the syrinx. So if you're looking at a cross section of the spinal cord, like how wide it is. 9 millimeters would be a big syrinx. Keep in mind the whole spinal cord is generally only about 12 millimeters. So 9 millimeters is large. And if I think it's being caused by the Chiari, it's pretty likely I'm going to recommend surgery, even if the child is minimally symptomatic or asymptomatic. The chance that, depending on their age, that they're going to develop a significant curve, a scoliosis, or develop neurologic symptoms over time, like those pain syndromes or other things, is pretty high. So I would generally recommend surgery for something like that, assuming the two seem to be related.
Sure. A question, now we're getting into more post-surgical stuff. So what do you recommend after decompression? So is age at decompression affecting those long-term outcomes? And how do you recommend those kids go forward other than, sticking out a PE for a couple months?
I think most kids that have a Chiari and with or without a syrinx after treatment, they should be able to get back 100%. I mean, it obviously depends. If they had a very severe presentation, that may change. But if it's like the typical headaches, like we said, scoliosis or syrinx, some swallowing difficulties, the like, most of those, after successful treatment, they should be able to get back to everything. Now, I will be clear, one thing I didn't address, so like if you have a Chiari and a syrinx, the goal of surgery is to reduce that syrinx, maybe make it go away completely. Usually not. Usually it's just getting smaller. But I think all of those kids need a follow-up MRI. And if the syrinx has not gone away at all, you have to question whether or not the surgery was effective. But if the syrinx has gotten smaller or gone away, then they should be able to get back to everything.
And then for a parent, particularly for parents of younger kids, what should they be looking for after surgery that might be a sign that they should come back to you if something might be wrong, longer term,
Right. And
short term too?
you know, every case is different, every child's different. So it's, you know, I just want to be clear when I answer these questions. It's like it's more around the average patient. So some people present in pretty tough shape. Like when you have let's say, because most Chiaris present with a headache. If you have a baby, you're not going to be able to tell when they have a headache necessarily. So when you have a Chiari and a baby, it actually tends to be a really bad Chiari. So this, you know, maybe their follow-up is going to be different. Like they're having bad swallowing problems and breathing problems. And that's how people got clued into the Chiari malformation. But for the average, like, you know, let's say child, teenager, adult presenting with a headache, you know, after surgery, you would hope that the headache is mostly gone. You know, again, if they were having a frontal headache, maybe that doesn't go away because it was never related. But most symptoms from the Chiari should get better, and the person should be able to get on with most normal activities. But again, that's for the average. You know, if it was a really severe presentation, then you may have to modify that.
Was again a perfect segue. So a 6-year-old with Chiari syringomyelia has already undergone surgery, but still has those semi-frequent headaches. So they're definitely better than before surgery, but if not a surgical intervention, what is the next step to kind of manage those headaches if it's not surgery?
Yeah, so we're in the process now of just like writing up an article that we looked at in some detail with our pain clinic. And the association of Chiari and headaches, because headaches are very common. You know, we like to think that they wouldn't be, but they're very common in kids. Like we have a busy headache clinic at our hospital, and most of the kids don't have Chiari malformation, but some do. And, you know, so we've looked at the presentation, whether or not they've had surgery, and who's likely to get better. And what we found is that if you have typical headaches, like, you know, it's with exertion, you're getting pain in the back of the head or the neck, you do better with surgery. Like, you know, you can get better with just medical treatment. So you don't have to have surgery just because you have headaches. But you do better with surgery. But if you have atypical headaches, in other words, headaches that are not, and there's classifications of this, but if you have atypical headaches, you actually do just as well or better with medical therapy. So in this particular 6-year-old, I think you said there was a syrinx. So to me, the real mandate for surgery then is the syrinx, and the real sign of success of the surgery is that the syrinx is going away. It's getting smaller or going away. The headaches, you need to know more about. I mean, if they're really classic Chiari headaches and you get an MRI and it still looks like the Chiari is present, well, maybe they would benefit from more surgery. But if they're sort of atypical headaches, they're like in a different part of the head, they're not exertion related, then it could be that a headache clinic is going to be the answer, because there's lots of treatments for pediatric headaches, and many of them are quite successful. And like I said, as or more successful than surgery would be, even if you had a Chiari.
And that tees up this question pretty well. What type of doctor? Because headache clinic sounds great, and I know I struggled about where to direct people, but are we talking about a neurologist? Is this something that their primary care doctor can take care of? who administers headache treatment?
Yeah, so I would always start with your primary care because they may be different pediatricians have different degrees of expertise in different things, and they may be very comfortable managing headaches, or they may be comfortable at least with the initial management of headaches. And if that's not getting better, they can send you on to a headache clinic. I'd say most headache clinics now are multidisciplinary, so it's not just one type of doctor. So like in our headache clinic, it's a neurologist, a pain specialist, and often like physical therapists, occupational therapists, because headaches can be caused by other things like neck disturbance, etc. So a little bit of it depends on what's available in your area, but most of these pediatric, well, I'd speak in the pediatric world, but most pain clinics are going to be multidisciplinary, where they have different types of specialists there, and sometimes you need, people respond better to like cognitive behavioral therapy, like what are their triggers of the headaches and how do you work around those triggers, etc.
This is another one I'm learning about today. So, have you seen hypertrophic olivary degeneration in the brainstem, so by the medulla? And is that something that could cause compression and headaches versus a Chiari?
I have not seen that. I mean, the olive is a specific like set of nuclei in the brainstem. I haven't seen that from a Chiari. So I'm just reading in the brains because from compression or a Chiari. I haven't seen it. It's, I don't, anything is possible, and there's a lot of things for which you would really need to see the scans to try and make the connection, but I have not seen that syndrome present.
Is it, so this is a good question. Is it normal for a syrinx to not go away after surgery? Or maybe it gets a little bit better, but it's not gone.
So those are two different scenarios, right?
Yeah.
So is it normal for it to get smaller and not be gone? That's actually pretty normal. So if you like imagine a balloon that's been inflated for a long time and you let the air out, it almost never goes back to its original size. It's been stretched out, the elastic walls have been weakened, so it's almost always bigger than it was. But if you have a syrinx caused by a Chiari and you do surgery, you do expect to see it at least get smaller. So I always worry if I have a syrinx that is just as big after surgery as it was before, or it went away and came back. To me, that probably speaks to something has happened after surgery and they may need another operation. Mm-hmm. Not common, and it's very uncommon for it to go away and come back, but it can happen.
Sure. And then this is really more of a question about longer term stuff. So if my son is 22, recently had surgery, but still having some symptoms, worried that the syrinx is going to come back, which is what the doctor was mainly worried about. They're not going to be able to see their current neurosurgeon because they're pediatrics. So how can this parent kind of counsel their, grown son, but to find an adult neurosurgeon that can maybe take over that care going forward so that it's not disjointed?
Yeah, well, obviously without knowing where they are and the like, I mean, most pediatric neurosurgeons are still going to be willing to follow their patients a little bit older. So, if someone I've operated on for a Chiari I malformation, they're now 22, I'd personally would still see them. Sometimes, I mean, it's just sort of the proof is in the pudding. Like, some people, they've gone through this experience, they're going to be nervous about it, and you just have to do another MRI and show it's not there. If you've had a Chiari and syrinx and you've get a study. I usually wait 3 months before I get my next study. The syrinx is smaller or gone. I don't often get another study unless there's an indication like someone's losing sleep over it or they have some new symptom. But it's reasonable to get another MRI if you get, I don't know when the surgery was, if you got another one now, and now we're 5 years after surgery. I mean, it's really unlikely it's going to come back. And that just begs the question, how long do you need to be followed? If I have someone who's been successfully treated, their symptoms or syrinx is resolved, they have no issues going forward, I don't tell them they need to come back and see me every year. So if this person, they're 22 now, but I don't know when they had the treatment, if they're many, many years out and they've had successful follow-up MRIs or MRIs that show successful treatment, and they get another one, it's successful, at some point, I don't, it's easy for me to say, just forget about it, but you really do have to just understand that you had a condition that's now behind you and you're treated, and you don't want to spend your life worrying about it.
Sure. And then I always end with this question. So how can people get in touch with you if they are in the area and maybe they want to come for an opinion? How can they find your clinic?
Yeah, well, we have at Boston Children's, we have 9 pediatric neurosurgeons. We're a big group. Several of us treat Chiari, but we're always happy to see the patients here. It's, as I'm getting a little bit more senior in my career, I'm not treating as many, doing as many surgeries as I used to, but there's plenty of excellent people. But I mean, they can always call the neurosurgery department at Boston Children's, and if they want to see me, they can ask for me. If they're, we have other specialists that will see Chiari malformation, so it's quite easy.
Actually, that made me think of something else. Would they go to the surgery department directly, or should they go through that headache clinic that you were talking about first, if that's really the main concern?
Well, it depends what they need
Sure.
to be seen for. If they're having headaches, yeah, for sure, the headache clinic is a better option. But if they have a diagnosed Chiari malformation with symptoms of Chiari malformation, then they should come to the neurosurgery department.
Okay. Thank you. I appreciate that. And thanks everyone for joining us tonight. The video will be available soon. And thank you, Dr. Proctor, for this great session.
Okay, thanks.
Thank you.